Hello everyone, I'm Nimit Devhan Gurunatha from first year second semester group 26. So today I will be talking about how to take care of a patient in a vegetative state. A vegetative patient is when a patient is awake but show no signs of awareness, and this is different from coma. As coma is when the patient is totally unconscious, so a vegetative patient may open their eyes with or fall asleep in a regular intervals or may be able to perform some basic reflection such as blinking their eyes. So vegetative patient could not control their body movement and perform their daily activities. So usually internal feeding is need for the patient who is in vegetative state, and a nurse should help them to take care of their hygiene, their body hygiene or hygiene, and also the nurse must check up with the patient vital signs every day. Hi guys, today I will be demonstrating how to care of a patient which is in a vegetative state. So the first thing we need to wear a pair of gloves, but here I don't have a glove around me, so I will just assume that I am wearing a pair of gloves. Then next we need to inform the patient about what are we going to do next. So hi miss, now I'm going to do oral hygiene and wash your mouth and have check your vital signs and wash your body. Okay, is it okay? Now after informing the patient, then next we are going to perform to clean the patient's oral hygiene. Before that, let's just use a blanket and to cover the patient to provide privacy and also keep the patient warm. Then keep the operation, the brush complete by brushing the upper inner, then outer part, then only the inner lower part. Okay. After cleaning the patient oral hygiene, then you must help the patient to wipe his or her body. So you need to prepare a warm wet cloth and wipe the patient's body first. Wipe the patient's face first. When the patient's face is wiped, then wipe the patient's arm, hands and chest, abdominal, following the leg, and the last one is the perineal area. After cleaning the patient, wiping the patient, then change the patient's diaper, is if the patient is using a diaper, or change the patient's drainage bag if the patient is using a catheter, and record the urine output if the patient is using activator. Lastly, check the vital signs of the patient. Vital signs include temperature, blood pressure, pulse rate, and also respiration. And that's all for how to take care of a patient in a vegetative state. And thank you so much for listening.